Good morning, Peter Goertz. I'm a psychiatrist. Are psychiatric diagnoses helpful or harmful? In my opinion, they can be both, and I'll get into more detail. What actually is happening when a patient is diagnosed with anything, medical or psychiatric, is that it seems to be the organism is out of balance in some way. And then we label that patient, and in, for instance, medical issues or illnesses like diabetes mellitus or hypertension, we often use numbers. So in diabetes mellitus, you use a number to measure the blood glucose. In hypertension, you measure numbers. You use numbers to measure the blood pressure. And they can be helpful in comparing blood pressures or blood glucose over time and between patients. In schizophrenia, you don't have anything to measure, at least in general, and use criteria. So delusions, hallucinations, you focus on speech, behavior. Now, at times there can be a genetic component, at least at times, there can be a genetic component to schizophrenia. And one example is the genetic disorder DiGeorge syndrome or 22q11.2 deletion syndrome. And quite a few of those patients develop a mental picture that is at least similar to schizophrenia, maybe about 25% of those patients. However, in the big picture, amongst all patients diagnosed with schizophrenia, the number of patients with the 22q11.2 deletion syndrome is very small, maybe 1% or less. So in general, in schizophrenia, for example, you cannot use medical issues or genetic issues to diagnose schizophrenia or any kind of numbers. One thing that diagnoses, for example, in DSM-5, do not talk about in the vast majority of diagnoses is causes, so the roots of those diagnoses. So, for instance, if you look at schizophrenia again, it does not address at all what might be the roots. Is it, for example, that genetic syndrome, DiGeorge syndrome? Is it trauma in childhood? Is it another genetic issue? Did the father have schizophrenia? So in general, the DSM-5 diagnoses do not contain aspects that talk about roots or causes of the diagnoses. Now, there are exceptions, for instance, post-traumatic stress disorder. In order to fulfill criteria for post-traumatic stress disorder, you have to have undergone trauma. Now, advantages of diagnoses are that doctors, medical professionals can communicate amongst each other. So if we say this patient has been diagnosed with major depression or PTSD, dissociative identity disorder, anxiety, any of those and many more, we get a ballpark picture of what's going on with that patient when we talk with each other about patients. And it also can be helpful to have a label or diagnosis regarding treatment, because then you can approach the treatment with, let's say, psychotherapy for depression or medicine. And the treatment can be, at least to a certain extent, guided by the diagnoses. Now, one potential pitfall of diagnoses is one really needs to keep in mind, in my opinion, that each person is an individual. So one schizophrenic may have a very different picture, very different symptoms, very different causes, potentially, from when compared to another schizophrenic patient with that label of schizophrenia. So we want to really not forget that each patient is an individual, is different, and the overall picture and the treatment that is effective can be quite different between patients. Now, another pitfall is from a patient's perspective, if they identify with a diagnosis. And let's say someone has post-traumatic stress disorder from combat in the military, and they identify, I have PTSD, I'm someone who suffers with PTSD, and that can become something they really internally identify with, plus they may get benefits, so they may get money from the government because they suffer with post-traumatic stress. They may receive a disability payment, and if they stop having the post-traumatic stress, then they may lose their disability payment. So there can be some motivation, even from a patient's perspective, to identify with that diagnosis and keep that diagnosis in order to keep the disability payments. So that can be quite difficult then, because these patients come in for treatment and they're getting benefits at the same time, and they don't really want to lose the benefits. So how to motivate them to do well in treatment and get better and better, and maybe even lose the diagnosis, that can be quite difficult. Another aspect of labels or diagnoses is prejudice. So if you tell a potential employer during an interview, I've been diagnosed with schizophrenia, they may think twice about hiring you. Or same thing, if you go out on a date with someone and it's your first date and you mention, I've been diagnosed with schizophrenia, they also may think twice about you, which is unfortunate. Both of those situations are unfortunate because it constitutes prejudice. They're not looking at you as the whole person, whatever the labels are that you've been given. Thank you.